Hi friends, welcome back to Ostomy Care with Angel Face Amy. I'm Amy, your helpful ostomy nurse, and today we're talking about something super important, knowing when your stoma is just being dramatic and when it's actually trying to tell you something is wrong. We'll go over what's normal, what's not, and exactly when you should call your wound and ostomy nurse. Let's dive in. So we have a normal looking stoma here. This is an example of a normal stoma. The stoma should be pink or red, kind of like the inside of your mouth, like your cheek or your gum tissue. It should be moist and maybe a little bit shiny. It might move or wiggle a little when you cough or talk, and that's completely normal. So it might even bleed a little bit. It can bleed when you clean it. That's totally normal too. Think of it like brushing your gums, and they might bleed when you bump them, but it doesn't mean that something is wrong. Now let's talk about stoma drama. Here's what's not normal and should get your attention. Color change. If your stoma turns pale, dark purple, gray, or black, that's not just drama. That's a red flag. It could mean poor blood flow or a serious issue like necrosis. That's an emergency, and you need to call your provider immediately. Okay, the next situation is no output if you have an ileostomy and nothing's coming out for more than 6 to 8 hours and you're cramping, nauseated, or vomiting. You could have a blockage. That's also a call now situation. Another problem is excess bleeding. If your pouch fills with blood or you're seeing bright red blood from your stoma or in your bag and it's not a tiny little bit from cleaning, call your doctor. When the skin's the problem. So we have a barrier here. Let's talk about the peristomal skin. The skin around your stoma, it should be free from rashes. It should be clean, dry, and intact. No open wounds or rashes. If your skin is raw, weepy, itchy, smelly, or oozy, it might be from leakage, a poor fitting wafer, or a yeast infection, and that means it's time to call your ostomy nurse. We can help assess your appliance fit and suggest the right barrier products or powders. Leaks. So let's talk leaks. If you're having to change your ostomy pouch more than once a day because it's leaking, something's off. It could be a poorly fitting appliance, a stoma that's retracted or uneven, or a change in your belly shape due to weight gain, weight loss, or a hernia. Leaks shouldn't be a regular thing. Frequent leaks can lead to serious skin damage and anxiety, and your ostomy nurse can help troubleshoot these problems. So red flags, we're going to do a quick checklist. If you see any of the following, it's time to reach out. First, stoma color is pale, dark, or black. Call your provider or surgeon. No output plus pain, cramping, or nausea. Call your provider or surgeon. Continuous bleeding into the pouch. Call your provider or surgeon. And raw or painful skin around the stoma, you're going to want to call your ostomy nurse. Frequent leaks you can't control, call your ostomy nurse. And a sudden fever with redness or swelling around your stoma, you're going to want to call your provider or surgeon. A pouch ballooning up constantly with gas or odd smells may mean infection or food issues, and you should probably call your ostomy nurse to see if she can work through those issues with you. When in doubt, reach out. Here's the truth. People wait too long to get help. They're embarrassed. They think they should just deal with it, or they've been told it's normal. Let me be clear. Your comfort, safety, and peace of mind matter. If something doesn't look, feel, or smell right, trust your gut and call us. That's literally what we're here for. I'd much rather get a call and say, "You're doing great, no worries," than have you suffer in silence or end up in the ER. So living with an ostomy takes some adjusting, but you're not alone. Whether it's your first week or your 5th year, we all run into bumps, and that's okay. So remember, call when something feels off, watch your stoma and your skin, trust your instincts, and call your ostomy nurse with questions or concerns. Thanks for spending time with me today on Ostomy Care with Angel Face Amy. If you found this helpful, hit the like button, subscribe, or share this with someone who might need a little confidence boost. See you next time, and until then, take care of your stoma and yourself.